Welcome to Medically Speaking. My guest today is Dr. Ashish Bhatia, a cardiologist and electrophysiologist at Gates Vascular Institute. Doc, thanks for joining me today.
Thank you for having me.
First, let's talk about cardiology and in particular the field that you specialize in. I do want to get into atrial fibrillation and all that, but if you can, start with the difference, cardiac surgery, cardiology, and then the specialization in electrophysiology, if you would.
Absolutely. So, cardiology focuses on all aspects of cardiac care. So once you specialize in cardiology, you can go into different subspecialties of cardiology, one of them being electrophysiology. Now, electrophysiology focuses on the electrical and rhythm aspect of heart issues. So majority of those being related to abnormal heart rhythm that may require medical management procedures in terms of ablations to fix those electrical issues. And the other aspect being related to the slow heart rates, which involves putting in pacemakers and device aspect of cardiology, including defibrillators and heart failure management.
Let's talk about some of the cardiac conditions that you specialize in particular atrial fibrillation, often called AFib. What is AFib and who's at risk here?
So it's, as you mentioned, atrial fibrillation, more commonly called AFib. It's an arrhythmia or an abnormal heart rhythm. It is the most common heart rhythm abnormality that we see in the adult population. People who are at risk are people who have history of hypertension, people who are older, people with obesity, sleep apnea, diabetes, or any kind of structural heart disease.
So in a community like Western New York, upstate New York, you have an aging population, one that has high incidence of cardiac and stroke. This is a specialty that really has seemed to grow in the last couple of years. Is a lot of it incidence and lifestyle, or is this pretty common, throughout the country?
It is pretty common throughout the country. I would say in the United States, more than 3 million people have atrial fibrillation. So we are not unique to this, issue, unfortunately.
You talked about some of the health risks when someone has AFib or they're diagnosed, but let's get to the diagnosis. What are the signs and symptoms, and how does someone know if they have an issue in this cardiac area?
So symptoms of atrial fibrillation can include mild palpitations to severe palpitations, lightheadedness, fatigue, shortness of breath, chest discomfort. However, some people with atrial fibrillation are completely unaware of it and have no symptoms whatsoever. So those are the patient population that we have to figure out because, as we know, atrial fibrillation increases your risk of heart failure, stroke, and even death.
So that's sometimes discovered as someone goes through a normal or routine primary care visit, or they're referred to a cardiologist. The ones that go unnoticed. How do we pick up the unnoticed?
So those are lucky ones that present incidentally, but we see a lot of those patients present with stroke and heart failure. So they come to the emergency room with a big stroke or progressive heart failure symptoms, and we find out that atrial fibrillation was the underlying cause for those events.
So I'm a patient or I'm a loved one of a patient, and I hear I have AFib, or my parent, my mom, my dad, my grandparents have AFib. How is it typically treated? Is surgery required? Is this an invasive process?
So, atrial fibrillation, it's a complex arrhythmia and its management is complex as well. So here at Gates Vascular Institute, we offer the most advanced and comprehensive treatment option for our atrial fibrillation patients. We are the busiest and the most experienced center in Western New York for management of atrial fibrillation. We also have the Atrial Fibrillation Center, the only center of its kind in Western New York. We're a team of cardiac specialists that work together to provide the most advanced and comprehensive care for AFib patients. Now, by having extensive experience in the most advanced state-of-the-art technology, we're able to maximize success rate while minimizing any risk or complications. So it's not a major surgery where we do it minimally invasively. It's almost like putting an intravenous line in you. So there's no incisions, no scars, and it's all done through catheters with high-density mapping, computerized technology that kind of all joined together to provide the minimally invasive approach to these patients.
Reassuring, I'm sure, for the patients who have to go through that and they realize they're not up against major invasive surgery. So for those patients or their family members, can AFib really be cured, or is it something that individuals just have to, monitor over time? Is this a lifetime issue if you're 60, 65 years old and you're dealing with AFib?
So, our goal is to improve underlying conditions that contribute to atrial fibrillation. Start with that. Improve symptoms associated with atrial fibrillation, stroke prevention, but the ultimate goal being the complete elimination of AFib. So yes, it is something that we can cure and treat and eliminate for our patients.
You mentioned the Gates Vascular Institute. Let's talk about that for a minute. What is so special about what we call the GVI? Why is it so unique for Western New York, upstate New York, or even across the country? What does the GVI mean for patient care?
No, it's an excellent facility. We love working there. It's, like I said, it's state of the art cardiac facility. And it's not just cardiac. It's vascular. It's neurosurgical. So we have multiple specialties kind of joining hands together to provide the best care that we can to our patients.
Dr. Ashish Bhatia is an electrophysiologist at the Gates Vascular Institute, talking about cutting-edge cardiac care right here in Buffalo, New York. Doc, thanks for joining us today.
It was my pleasure, and thank you for having me.